Bionox is motivating wellness.
Something that caught my attention is in your mission statement, which is nice to see, you know, what you guys stand for, and you got those 10 points in there. And one of the things that is mentioned is you like to teach each patient to empower their true health. This really lines up with what our motto is, to motivate, motivating wellness.
Motivating wellness. That's the reason I was really attracted by your company, let me tell you.
Yeah.
You know, who is the responsible person of yourself, of your health? Yourself.
Right.
And one of the things that I do in my practice is, first of all, trying to teach the patient. And I said, you know, it's your set, it's your body, it's your brain, it's your heart. It's you, it's not the doctor. It's not the nurse. It's not the nurse practitioner. It's not your wife. It's not your son. Yourself. You are responsible for your body. And that's one of the things I have to empower the patient to do that. And that's, by the way, that's one of the main reasons that your company attract me a lot. You know, nitric oxide is the greatest molecule of our body. Motivating wellness, best. I'm also a golfer, you know.
Okay, good. Awesome. That's great. Yeah, we love working with Chris DeMarco. He provided some great entertainment back in the early, mid to early 2000s, and so we're great. He really is an advocate of health himself. He really does truly live it. So we're glad to be teamed up with him. You know, he's in his 50s, and it's a good time to really pay attention to your health. So appreciate that. Tell us, if you could. I know you can't give us names, and we don't want you to, but maybe you could just give us a few of your success stories, of ones that have come to your office that stand out to you. Is there ones that come to mind, that how they came in and how they've been able to live their life now, that you can share with us?
Of course. Yeah, I have a lot of success stories, even for female patients and male patients. Females try to be a little more disciplined, had a lot of discipline. That the female used to motivate herself much more than men, and try to be more aggressive with a good health. Let me tell you, by the hormones, I whenever the patient comes to my office, I try to balance off the hormones. Testosterone is it's a very important hormone, both for males and for females. And and by the way, I'm using the optimal levels of nitric oxide, and I test with the strips. And those patients that use and keep the nitric oxide levels elevated have much better levels of the hormones. If you go to testosterone, the total testosterone is higher in those patients that use nitric oxide supplement and a diet, and specifically a diet trying to increase the nitric oxide, that those patients that not. Both total testosterone and free testosterone, and the same happen with all the hormones, the same. But I used to have questionnaires before and after, so questionnaires about all lifestyle and healthy living, like headaches, tiredness, energy, sexual performance, joint pains. And let me tell you, most of the patients came with a list of moderate to severe symptoms in all these points. And after that, they came with mild to moderate escalation of all these symptoms. But especially I have a patient, actually it's a female patient, She's a true believer. She is 85. 85. She's a very active woman. Very, very compromised herself, committed with her health. This lady had an inferior myocardial infarction around maybe 15, 20 years ago. And after she had the myocardial infarction, almost fatal, she decided, no, I want to change everything in my life and go the other way. After 5 years after the myocardial infarction, she recurred with a coronary artery disease, and actually there was only one coronary artery involved in the inferior infarction. Then she started to develop a progressive coronary artery disease and the other branches, the left anterior descending and the circumflex. And finally, she got operated after that. After that surgery of coronary artery bypass graft, she decided, okay, no, I stop. She moved to the bigger life. She used to balance all the hormones. She is one of the users of the Bionox products every day. And if you see that patient now with 85 years old, is even younger than when she had the myocardial infarction. By the way, if she hadn't done everything that she did with the change in his lifestyle, I don't think she will be alive at this moment. It's very impressive. She's very active. She has the right thinking. She's very focused. Nothing about memory problems. Nothing about selecting words. She's very active at home. She practices kind of sports, and she's one of the values of my practice. And she's 85. Let me tell you, 85, reaching 86.
That's fantastic. You've really helped to teach her, to empower her true health. And at 85, it's paying off. And what a great story. So let's jump into my favorite topic, and it sounds like it's one of your favorites, and it's this molecule. So when it comes to a healthy endothelium and nitric oxide, as it relates to many cardiovascular issues. So, you name the cardiovascular issue as you think about, and all of them. How is it that a healthy endothelium and nitric oxide plays a key role?
It's very important. One of the problems with nitric oxide, this is a gaseous molecule, and the half-life of nitric oxide is very short. So you have to have a constant level of nitric oxides. That's the reason I try to keep it. And nitric oxide increased the function of the endothelium. And most of the patient, and I see a lot of patients with endothelial dysfunction that I can measure, by the way, using a different kind of machines. One of that I use very often is the echocardiogram and the Doppler. When you go to a Doppler of the mitral valve, you see how intense, and you can grade the endothelial dysfunction. And following this patient, I use the nitric oxide supplement and the other kind of diets, going to grief leaf, braided veggies, beet, and all that we know that increase in nitric oxide. And you see a change, a grade from grade 3 to grade 2, grade 2 to grade 1 in the diastolic dysfunction. And this is one of the most important aspects that I emphasize in my practice. In addition, I try also to look to the glycocalyx. The glycocalyx is the internal part of the artery. It's a small like hairs that if you have a healthy glycocalyx, you have a healthy artery, because all the cholesterol, all the particles, all cholesterol particles don't stick to the endothelium. And as you know, the endothelium is an organ, is the largest, if not the most large organ that we have in our body. I believe it's the largest, even than the skin, because the skin is supplied by blood vessels, and the blood vessel, there are lots, trillions of blood vessels in our body. So I believe the endothelium is the largest organ that we have, and it's an organ. It's just verified that the endothelium, scientifically speaking, is an organ. So, and the better your endothelium, the better will be your health. And nitric oxide is the best friend for the endothelium. That's the reason I use a lot of all the nitric oxide products and test my patient and give strips to them to test themselves. By the way, I have a patient that is very interesting. This guy, he had pancreatic, prostatic cancer about 4 years ago. In that moment, I intervened with him, and he used every day the Bionox, and I don't see I don't know why. I don't see the nitric oxides increasing that, let's say, his wife used. His wife used the products as well, but the levels of the nitric oxide increase much more than in him. I don't know why. I believe that the inflammatory state that this patient had probably is affecting, or probably he will need a higher dose. And let me ask you a question. Have you have any patients or any study or something that tells if I can use your product 3 times a day?
Yeah, the toxicity levels of arginine in particular is very high. If I remember right, I want to say it's like 80 grams or something like that. It's outrageously high. So yeah, we have had people use up to 8 scoops a day.
Oh, really?
In very rare cases. That's a rare case. So that gives them their 20 grams of arginine, and it would be on the citrulline. I'm trying to do the math. I can't do it right quick, but at any rate, that's pretty rare. We find that even with people, the testing modalities that we use besides the strips is plathismography screening. And with the plathismography screenings, when we see certain types, we'll titrate up on the dosage. Typically, even in severe cases, 4 scoops, maybe 6 scoops a day is what we're seeing. But okay, definitely.
So it's a good practice to tell the patient, okay, go ahead, move to increase to 3 and try to escalate, try to titrate up the scoops from the product and test on yourself. And when the strip is on the threshold, you are okay. If it's 5, 6, or 7. Let me tell you, I reviewed it again, all data regarding arginine, and found nothing bad except one trial many years ago that found that arginine increases the risk of myocardial infarction. But now that the other side of the coin is much safer than that trial.
I've seen several rebuttals to that study. Dr. Prendergast, who died in 2020, he is one of the first clinical doctors that I've seen. He's an endocrinologist, diabetic specialist, and his story is just phenomenal. What happened to him personally, as well as with his patients. But anyway. He did a rebuttal, and he said, why, first of all, did you start giving less arginine when they started to have angina and symptoms? He said they should have been giving more. One of the other things is, my understanding in that study is they used a arginine hydrochloride, which can create imbalances with potassium. So it could be that they bottomed out their potassium levels, and you know how important that is if that happens. So anyway, and I think the majority too of the ones that did pass away in the study, they actually died of sepsis. It wasn't so much the myocardial infarction, but anyway, I've seen at least 3 doctors do rebuttals to that particular study. They didn't like it at all. And as you know, that can happen with studies. If they're trying to make a point, then they can skew it. But anyway, that's my feedback on that.
Great. Do you have any other study regarding the ischemic threshold before and after using the product? I mean, the data with stress testing, let's say, with suboptimal levels of nitric oxide and optimal levels of nitric oxide. Is there a study?
There is, of course, the ones that I was introduced to initially were rabbit studies.
Okay.
And one was by Dr. Cook, who's the head of cardiovascular research at Stanford, and then Dr. Ignaro, which I'm sure you're familiar with him, one of the Nobel.
Of course, yeah.
They both did rabbit studies, and they showed optimal plaque regression with arginine, citrulline, and vitamin C and E. So those, and we use that as a basis for our formulas as well. They all each have their benefit. So those rabbit studies actually showed the plaque regression. And I'm sure there's other studies too that could.
Okay, yeah, I will try to review the literature regarding that.
Yeah, very good. Well, I tell you, you've given us a lot. We appreciate you being an advocate of the Bionox products. And of course, our M3 product is primarily our arginine citrulline based nitric oxide with a little bit of nitrates in it from beets. And then you may have seen that we're offering now our primarily nitrate pathway products with the beets and the green.
Yeah.
Right.
And you can combine both, right?
Exactly. So sometimes one pathway is challenged. That's the other thing with the patient you mentioned.
Yeah,
maybe his arginine, his enos synthase is not good. And so using more of the nitrate-based products, as well as Dr. Gary Gordon, the forefather of chelation, he talks about how lead can jam up the enos pathway where zinc is supposed to be helping the completion. And so we need to chelate the lead out of the artery. So that's another thing.
Another way to do it. Okay, great.
Yeah. But thank you so much for being an advocate of what we do. This has been a very memorable interview for me. I appreciate so much your words. I'd like one day, hopefully, to come and see your practice and see all the things that you do. I know the A4M is doing their spring event in Hollywood, Florida this year.
Yeah, I believe so. I used to speak in the international conference in Las Vegas, and they will probably invite me to speak
nice.
about any specific topic. So nitric oxide is one that I have in the radar to speak of nitric oxide. It was really a pleasure having having you in the interview, and your invitation was really appreciated. I'm here to serve, and if you need any other information from myself, my clinics and everything, and as you wish to visit us, I would like to visit your place as well. So
that'd be great. That'd be great.
And just a podcast or something, just let me know.
Okay, and one final thing, Dr. Tanus, how can people get in touch with you and your practice if they're needing some help?
Yeah, I have web pages. Usually in my emails, it's doralcardiology.net for those in Miami, and vascularnutritionpr.com for those living in Puerto Rico.
Okay, good.
That's the best way to to get in touch with me. I will gonna have an app, Tanus NutriHealth, that will be is now in the market soon.
Very good. Awesome. Well, again, thank you so much for your time. And again, it was a pleasure. And I feel confident that we will see you down the road.
Of course. My pleasure, Dr. J.
All right. Very
Bye-bye.
good. Take care. Bye-bye.
Take care too.